Hi everyone, welcome. Good afternoon or good morning or good evening, wherever it is you're joining us from, and welcome to the Smart Prosperity Nature of Health event. My name is Harshini Ramesh, I use she, her pronouns, and I'm a research associate at the Smart Prosperity Institute. Before I give a bit of a breakdown of today's session, I did want to acknowledge the land that I'm coming in from. So I'm calling in from the treaty lands and territory of the Mississaugas of the Credit First Nation, as well as the traditional territory of the Huron-Wendat and Haudenosaunee people. While all of us are joining in virtually, I would like to acknowledge the importance of the lands that we're calling home today, and a land acknowledgement is just one of many ways to reaffirm our commitment and responsibility in improving relationships between nations, as well as improving our own understanding of local Indigenous peoples and their cultures. So please join me in a moment of reflection to acknowledge the harms and the mistakes of the past, and also to consider what we can do moving forward in the spirit of reconciliation and collaboration. Thank you all for reflecting with me, and thank you so much for joining us today. This is the first event of a three-part webinar series exploring the intersection of health, nature, climate, and the economy. I'm sure there will be links shared in the chat. There are two other events that we'll be having next week on November 18th and the week after on November 25th. So please join us for those events as well. The webinar today is on our first report, which is the Nature of Health, Integrating Health Considerations in Urban Nature-Based Solutions, which is available in both English and French. The link will be shared in the chat very shortly. So please feel free to take a look, and I encourage all of you to read it. It's a really good piece of work. To give you a bit of an outline of our event today, we'll have a presentation by my colleague Michael Twig, and that will be followed by a moderated discussion with our two panelists, and it'll finally be closed off with an audience Q&A. Just a bit of housekeeping. Please submit your messages or questions, in the panel in the QA box, which you can find at the bottom of your screen. The event is also being recorded and will be available on SPI's YouTube channel tomorrow, which I think there will be a link that also be dropped in the description, not description, but in the chat box below. So just to hand the mic over to my colleague, Michael. Michael Twig is a research associate with Smart Prosperity Institute, and he focuses on the nexus between urban nature, human health, and climate change. Off to you.
Thanks very much, Harshini. I'll just try and share my screen here quickly, and we can jump into a bit of a recap of the report that Harshini just introduced to us today. So just bear with me as I get to. So I think everyone should see the title slide now. So as Harshini mentioned, I am a research associate with the Smart Prosperity Institute. And I was also the lead author on this report. So if anyone has any questions that we won't be able to address today, please feel free to reach out by email at any time, as I would be happy to carry the conversation on at a later date about any of the topics that we mentioned. So just to get an idea of how we're going to proceed over about the next 20 minutes, I just want to share a brief overview of the main points that I'm going to try and hit on. So the first of these are going to be the real high-level messages, key messages from our report. And then we're going to try and answer some of the more detailed questions that the report was aiming to answer, such as what are the health benefits of urban nature? How are local communities addressing the health-nature link? What is the value of good environmental health? What methods are best suited for nature-based health projects? And what tools can support these types of projects? So just before moving into the key takeaways of what we're trying to aim at getting today, we're going to look at some of the challenges that are left that need to be addressed, and where are there opportunities for innovation. So as I mentioned, the last thing we want to try and touch upon is what are the key takeaways? And this is really going to draw into the three areas of prioritization that we identified in the report of where we can accelerate the movement towards better environmental health across Canada. So first, let's go with the key messages. So the first key message that we represent in our report is that nature-based solutions can generate a significant amount of value in terms of health benefits. And this is a value we estimate could reach up to 100 billion by 2050. The next message we have is that health benefits from urban nature are not distributed equally. And as recent research from Stats Canada shows us, vulnerable populations and low-income communities are disproportionately affected by poor environmental health. The next key message we have is that health benefits are dependent on the accessibility of nature, and there are many qualitative aspects that are important for determining who benefits and by how much. And finally, we need standards and best practice guidelines, and these will go a long way to help successfully integrating health considerations when designing nature-based projects at the local and regional level. But before we get too far ahead of ourselves, we actually have to talk about what are the health benefits of urban nature. So our report shows that they can be broadly divided into 5 categories, those being physiological, social and community, psychological, mitigating and adapting to the impacts of climate change, and reducing negative exposures to environmental conditions. From these, we tried in the report to identify which would be the most applicable in the Canadian context by ranking them from strong to emerging based on the overall amount of evidence, the availability of Canadian case studies, and the level of consensus around the availability of measurements and evaluation techniques that are suitable. So some of these that we identified as the most strong as of today, where they could be ready to be accounted in project level accounting schemes, are those linked to reduced cardiovascular disease, those linked to improved mental health as a result from reduced stress and anxiety, and those linked to a reduced exposure to pollutants and negative environmental outcomes such as extreme temperatures. But the main thing I want to point to now is that the way these health benefits act between urban nature and the benefit in terms of changes in health outcomes is not always straightforward. So to explain what I mean by that is I'm going to share 2 more broadly detailed findings about these relationships that were particularly interesting throughout the course of doing this work. So the first of these is that greener is not always greater. And when we're talking about this, we're talking about it in the fact that greener is not always greater in terms of the potential health benefits that they would be delivering to local communities. So when we're investing in nature-based solutions, we need to consider other factors than just how many parks, trees, and green spaces there are and how close they are to people's homes. So we do have recent research out of Saskatchewan that shows us that green spaces with noisy adjacent trees, noisy adjacent streets, difficult access routes as a result of encroachment of trees, dangerous intersection, and other things like that, as well as elevated danger levels, can actually have a negative impact on the health-nature relationship for certain population groups, including young children and their parents and seniors. The second of these is that noise pollution is a very serious and under-addressed health concern of city living. Alone, it has been shown to lead to an increase in developing cardiovascular disease, hypertension, and high blood pressure, as well as result in significant cognitive impairment and leading to more stress and anxiety. And it can even result in certain negative pregnancy outcomes, such as low birth weight and small for gestational age. Now, the link with urban nature here is that urban nature is great for reducing noise pollution, but the key is to find out exactly how integrating more urban nature into the urban landscape plays a role that can benefit the most people and over the long term. But again, the key message that I want to point to today as a finding from our report is that there is sufficient evidence for us to move beyond the paradigm of questioning whether urban nature benefits human health and start investigating in how we can account for the health benefits when investing in nature-based solutions to make this a fundamental part of building healthier and more resilient communities across the country. So in order to figure out what exactly is happening across the country in terms of the health-nature link, we looked at how local communities are addressing this link by examining 26 strategic plans from municipalities and almost each of the 13 provinces and territories. So a few of our findings from this scan were that local capacity is a question mark. And what this means is that local governments across the country have a pretty good understanding of where the link between human health and urban nature actually exists, but their capacity to be able to address it remains pretty low. The next finding we had was that there's limited availability of ecosystem and health data, and this is a significant challenge for moving these types of projects forward. There are encouraging signs from larger municipalities working on tackling issues of inconsistent health data sets, but more of an effort needs to be made to support similar efforts in places where the capacity to collect data remains a major barrier. Another outcome from this scan that we found was that community engagement strategies are inconsistent. And that by itself isn't really that much of a drawback, but the big problem that we found was that long-term community engagement for nature-based projects that focus on health are low. So what we did notice there is that there are innovative strategies that are being applied in terms of being able to adapt strategies over time and engage in long-term community engagement for these types of projects, such as community resilience hubs being piloted in the city of Montreal. But overall, there were few indications as to how these investments would be able to respond to evolving environmental health needs of different local communities in the absence of long-term community engagement strategies. Another outcome we found was that similar project tools are being used, which means there's a lot of uptake among different local and regional actors, but that these tools are not always being properly calibrated for measuring health benefits specifically. And the main result here was that there's an ongoing and deep uncertainty around proper tool selection and application. Typically, this ends up leading to costs that are too high to overcome or administrative burdens that are too high to overcome in order to start accounting for health benefits directly. And finally, we note that expert consultants and specialized coalitions are driving innovation and encouraging collaboration between multiple levels of government and across departments. Now, these groups will continue to be crucial for mainstreaming environmental health considerations in local planning, but strong consideration should be given to formalizing corresponding environmental health units at both the local and regional level to ensure that this capacity is not lost for ad hoc one-off projects. So now that we know the general landscape of what's going on in Canada, we need to kind of delve into the idea of what is the value of good environmental health. So the main thing we examined in the report is the fact that the way we account for health and nature benefits needs to be thought of differently. For health, where we draw value, what we call value endpoints, is more subjective and it means that different health outcomes are different for different people. So essentially what this means is that care in determining what the value of good environmental health is needs to take into consideration that valuation methods and project evaluation techniques can account for both health and nature separately as well as collectively. So when we're thinking about what exactly are the value endpoints of good health and good environmental health, we can point to the three main areas that we found in our report that highlight what these types of values are drawn from. They are, first, the better prevention and treatment of illness. Second, ensuring wage earnings and maintaining productivity. And finally, the lessening of pain and suffering. Now, the last of these is what makes valuing good environmental health really, really different. The fact is, not everyone has the same capacity to seek treatment, and earning more and being more productive is not a perfect indicator of good health. We must also take into consideration the underlying social determinants of health so as to not overshadow the lived experience of different populations that may produce less and live with more pain and suffering. So if we do everything right, we're able to establish a good value for environmental health. How are we going to express these values? So we found from the Canadian experience of the case studies that we examined, it can range from anywhere from a 12% reduction in cardiovascular disease to $227 million a year in health cost savings from better air quality, to up to $4 million a year in health cost savings as a result of better life satisfaction. But the expression of value itself depends on the type of methods that you use and whether you're seeking to maximize financial returns, ecological outcomes, or community health benefits, or if you're trying to do what we're trying to do here today, whether you're seeking to find the most cost-effective strategy to do all three. So the next part of the report moves on to exactly what types of methods then, if we're trying to maximize all three of these areas, are best suited for nature-based projects using a health lens. So we first examined market-based methods because they are the most common and they can help encourage cooperation across sectors by using common market language. But we did find that these are also less well suited for understanding values linked to reduced pain and suffering and for understanding things like equity of access and passive exposure benefits. So we do recommend to capture these missing elements, a form of contingent valuation or subjective well-being approach is much more recommended, but it should be noted that these methods also come with their own drawbacks, such as being more complex, more time-consuming, and less able to compare across different case studies. So to avoid the partial pitfalls and potentially ignoring different determinants of health, we do recommend some type of combination between market and non-market methods. But the main thing to remember is that market methods are more than suitable, but that without taking into consideration some of the underlying social determinants of health, they may undervalue certain types of health benefits, and they may be able to be less well adapted to understanding issues of health equity and how we access nature. So the next thing we examined on the screen here on the right-hand side is project evaluation instruments. So we took a look first at cost-benefit analyses as a result of them being widely used for natural asset projects across the country. And unfortunately, what we found is that these are actually one of the least effective for measuring nature-based projects using a health lens. Instead, our report shows that using something more along the lines of a cost-effectiveness analysis or a comprehensive multi-criteria assessment are each better alternatives to capture the timescale and multiple dimensions that that nature-based projects have in terms of their health benefits. So moving beyond evaluating a project and establishing the economic valuation methods that are the most suitable, we then look to see what tools are available to actually operationalize these ideas on the ground. So we examined a multitude of different tools. I believe there were over 30 in the report itself, but we're just going to touch on a few of these today to keep it for the sake of brevity. So the first of these were vegetation indices. And we noted that these are widely used in order to evaluate how health and nature can intersect in an urban setting. These types of tools are highly technical and can be a little bit costly. And one thing to note is that they're not always well suited for capturing differences in green space quality and who has access and how benefits from these green spaces are being distributed to different populations. Alternatively, we looked at land use databases as well, and these can capture many of the differences that are ignored by vegetation indices, and they're typically cheaper and less technical, but they do also have trouble in determining who has access and how benefits are being distributed over the long term. So the last thing I want to note about natural asset evaluation tools is that natural asset inventories have emerged as a fundamental tool for collecting and developing long-term horizons for ecological data to understand not only how changes in nature are being affected by investing in nature-based solutions, but also providing baseline ecological data to understand how they then connect to health outcomes. So we did highlight several of these in our report, but a few of the examples that I can provide to you quickly here are the U.S. Forestry Service's iTree tool, Open Tree Map, and the Sustainable Asset Valuation tool. Now, in terms of projects that are a little bit more shovel-ready and are looking to move beyond the idea of evaluating what might be feasible, we have health impact assessments. So this can really provide an opportunity to encourage greater collaboration between health and non-health actors while applying a holistic view of good health for your project that has health equity and community participation as a central component. So used well, these types of assessments are well adapted to understanding multiple dimensions and changes in health outcomes and can be a great benefit for looking at nature-based health projects. And the last of these that I want to mention is the conceptual framework developed by EcoHealth Ontario. So this framework aims to support users with step-by-step guidelines on how best to articulate connections between green space investments, health returns, and associated cost savings during project design and implementation. Now, the framework does depend on the availability of local data sets, and it does require user initiative to consider less direct health outcomes, which are things like health equity, accessibility, and who gets to experience these benefits over the long term. But the main thing we want to highlight today is that in recent pilot projects using this framework in the cities of Brampton and Peterborough in Ontario, they have been able to demonstrate that investing in nature-based solutions using a health lens can provide benefits for municipalities of between $3 to $4 million a year. So with a lot of the action moving forward and a lot of the benefits being shown here, there are some challenges that are still left that we need to address before we can fully move forward with projects that focus on environmental health that use nature-based solutions as their main tool. So for starters, I want to point to the fact that natural infrastructure projects typically take longer than gray infrastructure projects, and realizing health benefits can take even longer still. While there is some uncertainty around the connection between different types of nature-based solutions and specific health outcomes and how best to account for these health benefits at the project level, the extra long time horizon can then be even riskier and can serve as an even more major disincentive for investment in these spaces. The next challenge we noted was that local environmental health data is limited. There are many gaps in the existing data set, and the metrics to collect new data at the local level are inconsistent. This means nature-based health projects are typically one-offs that have high relative costs when compared to other project alternatives, and that additional time and resources that are needed to overcome a lack of data is likely to steer people away from using a health lens when designing their nature-based projects. Another challenge we noted is that local governments and public health authorities have a limited mandate to act on environmental health, with policies and priorities set at the provincial and territorial level. So without an explicit mandate to include environmental health, project planning and program design are then limited when planning and building for healthier communities. This will cause this type of planning to remain ad hoc, and it will suffer from more competition to secure funding, which means during compromise periods, some priorities, those around health especially, may get left behind. And another challenge we noted is that existing funding streams are fragmented and currently insufficient for stimulating collaboration across jurisdictions. So we are seeing more and more at the local level that health and nature are connected. But what we're seeing in terms of funding streams is that integrating these considerations across local, provincial, and federal jurisdictions ends up resulting in investing in different aspects of either urban nature or health, and rarely both. And finally, better engagement and more responsive project designs are needed. Vulnerable people are disproportionately being impacted by poor environmental health, and a balanced approach that addresses greater health equity and access to urban nature while also protecting against the risk of green gentrification will require that these voices are prioritized in any type of project planning. Now, integrating these considerations successfully will be difficult and will likely cost more, but they're also a requirement for making green spaces more equitable and more accessible for people over the long term to ensure that health benefits are distributed to all community members. So overcoming these challenges may seem like a lot, but there are a lot of opportunities for innovation when using a health lens to invest in more urban nature. And the first of these, which I've mentioned a few times today, is that accounting for the health benefits of nature-based solutions in Canada clearly makes economic sense. The evidence shows us that health benefits from nature-based projects are already generating annual health costs of up to $4 million for local governments and $227 million nationally. And with a growing number of tools to support project design, there is ample opportunity for innovation and investment for those seeking to take advantage of these types of returns. The next innovation that we have here is that there is room to improve diagnostic tracking and reporting of environmental health factors during patient intake. If, as we noted, data missing is one of the major sticking points, providing an option and an incentive for frontline workers to track and report on environmental health issues during patient intake is a necessary solution to understand how urban environments are directly contributing to rates of mortality and morbidity. So changes in diagnostic reporting are not all that far off. We had revolutions in these areas and innovations in these areas during the COVID-19 pandemic. And we also have experience over the last 15 years with environmental health tracking in the province of Quebec. So both of these put together should provide us more than enough details and information to be able to build a roadmap to scale this type of reporting and these changes across the country. Another opportunity that we would like to talk about is that there's an opportunity to empower local governments and local public health authorities to act with that clear and expanded mandate that I already mentioned that prioritizes environmental health. There are multiple ways we can do this, and some of them could include creating legislative structures and institutions that encourage local governments to tackle these issues that can then have a drastic impact on removing some of the time-consuming and costly processes that are currently required to integrate health considerations when seeking to invest in nature-based projects using a health lens. And finally, advancing natural asset management to incorporate health dimensions may be an innovative strategy for accelerating the integration of these type of projects. So existing frameworks are out there, such as those offered by the Municipal Natural Assets Initiative, and they follow a similar process for analyzing engineered assets that cities and towns account for as part of their financial planning and asset management programs. Using this or similar models as a roadmap for integrating health considerations would help to develop a standard process that could be scaled across Canada alongside existing natural asset accounting schemes. So that brings us to the end of our recap. And I just want to finish with a few of our main takeaways that we can focus on in order to try and carry the conversation forward. So the first of these is that we know that more urban nature can provide significant health benefits for Canadian communities. And we also know that accounting for the health benefits of nature-based solutions is possible and it makes economic sense. But the main drawback that we also know is that communities across the country are still struggling to account for the health benefits of nature, and more needs to be done to enable greater action on environmental health at the local and regional level. So with that being said, I'd like to finish our recap of our recap by reiterating that there are 3 priority areas we can highlight in our report as being able to accelerate the integration of health considerations in natural asset accounting. The first of these that's already up on the screen is that we need to empower local governments to act on health with a clear and expanded mandate that can help lower uncertainty and provide an incentive for greater action at the local level. Next, we need to harmonize strategies and develop best practices to mainstream the use of a health lens when designing and investing in all types of nature-based projects. And finally, we need to align institutions and funding streams to specifically target the nexus between health, nature, and climate in Canada, and prioritize good environmental health as a fundamental aspect of city living moving forward. So that brings us to the end of our report recap. And before I pass it back to my colleague Harshini for a few questions, I just want to say thank you again for everyone for being here today. And if any of the content we covered in the reports piqued your interest, again, please feel free to reach out. I'd be happy to carry on the conversation at a later date. Thanks, and back to you, Harshini.
Thanks so much for that incredible overview. I think it set up a really, really good base for the conversation that we're going to have with our incredible panelists. So I'm really pleased to be able to introduce both Dr. Shira Freeman and Brian Bouchard to sort of be a part of this conversation that we're having today. So Dr. Shira Freeman has worked for over 25 years in the field of sustainability. She pairs her background in environmental and health economics with experience in knowledge mobilization to provide support for decision-making by stakeholders in municipal public health and environmental agencies. She has also worked extensively with environmental public health professionals across Canada. And Brian Bouchard has worked for 32 years as an urban design planner for the city of Peterborough. And among many other projects, Brian has completed the development of Peterborough's signature waterfront Millennium Park, as well as many other parks citywide. So clearly we're joined by an absolutely stacked panel today that I'm very excited to be moderating. I'll kick this off by first going to Shira and just asking the first question of, we know that cross-engagement and cross-sector engagement will be key for advancing the issue of environmental health in Canada. So what do you think are some ways that we can actually encourage this type of collaboration? And are there any tools or approaches that we can make starting this process any easier?
Thank you, Harshini. I'm going to just start with one of Michael's takeaway points, which was empower local governments with the mandate to act on health. And one of the ways of doing that is to engage the public health sector more actively. And so I'm going to answer your question specifically with reference to ways of engaging the public health sector in what are typically non-health decision-making areas in urban planning. And there are a number of ways of doing that, but a very, very important set has to do with the tools and instruments we use. And the other is how those instruments are integrated in holistic assessment frameworks. So let me just zoom in with a couple of concrete examples, because what I've just said is fairly abstract. On tools and instruments, again, this report did a really, really good job of summarizing the pros and cons of various tools and instruments. And I'm just going to give a quick comparison for the audience of why one might choose to use cost effectiveness analysis and cost utility analysis as an alternative to cost benefit analysis as a means of engaging the public health sector more actively. And the simple reason is that while cost benefit analysis is the typical workhorse of environmental economics in many planning and environmental assessments, cost effectiveness analysis and cost utility analyses are the workhorses of the public health sector. And for all the advantages and disadvantages that are listed in the report, which people can read, one of the things here is that health is typically measured using cost effectiveness analysis or cost utility analysis, and finding ways of using those tools, which are already in use, for which there is data development and data gathering, would really answer a lot of the issues around where's the data, how do we collect it, how do we use it. I'm going to just now vault over to assessment frameworks very quickly and say that health impact analysis is a framework that is currently being used actively within the public health sector and integrates a lot of the tools and instruments that are detailed in the reports, including, of course, things like cost effectiveness analysis, in a way that allows public health to operate effectively. Health impact analysis has other advantages. It's compatible with environmental assessments. It's stepwise, flexible in the same way. It has another advantage in that it doesn't only look at the detriments, it also looks at the benefits of different projects. And it's also equity-based, so it's very, very well integrated. And in addition, another benefit of health impact assessment right now within Canada is that there are some very, very unique opportunities that are time sensitive right now. And those are the clean recovery initiatives that are in place that are calling on engagement of the public health sector and that are specifically focused on health. The other is the new Impact Assessment Act, which, while it doesn't directly affect municipal projects, it does affect a wide swath of federally mandated impact assessments for natural resource and large infrastructure development. Why is that important? Well, because it specifies the use of health impact assessment, and we can expect that over the years, techniques of assessment, data collection, engagement of the public health sector are going to become more highly developed for those types of assessment, and they will provide a really good resource for municipal decision-making and possibly some kind of a trickle down. And I'm going to stop there because I think I've been talking for a bit, and I can elaborate on any of these during later question periods.
Thank you. I think that was a lot of really, really good information. And on that line of sort of engagement. I'm not sure if Brian, you're still with us, but I was going to pose the question of, in your opinion, what types of, hello, are you still with us?
Yeah, I'm still with you. I'm just trying to, for some reason, my video has turned off.
Oh, that's okay, it happens. But I did want to turn to you and ask along the lines of engagement, what types of strategies can we use for engaging local communities and encouraging a greater connection to urban green spaces? And would adding a health component, for example, significantly change our approach?
It's in the case of Peterborough with the development of our urban park, we knew intuitively that doing this sort of project would have the effect of elevating the local community socioeconomic status. We also understood the challenges too in trying to monitor the impact on health of the local community with the development of our green space project. In that, and as Michael has alluded to, one of the challenges is the effective accumulation of the baseline health data, as well as a way subsequently to monitor the impacts of the green space development on that local community. Also, as highlighted by Michael, guidelines, I think, would be very useful with the development of these sort of green spaces. What were the other components of your question there?
Oh, the second part that I just wanted to touch on was, do you think that adding a health component, for example, would significantly change our approach?
I think it would, and I think it's currently the way people are thinking these days. People want environments that help improve their health, both mental health and physical well-being. So it's that lens is becoming more and more prevalent among the public and our serving politicians.
Thank you for that insight. I guess sort of pivoting then, both have touched on, I guess, the data issue and ways that we can be integrating health. To Michael, from a project design perspective, what do you think are the major challenges for advancing nature-based solution projects and that can track and actually account for health co-benefits?
I think I'm going to be echoing a lot of the same points around data. So I can say that in my mind, it's twofold. So the first thing is that data is not there. We're not at a point where we can safely say that this data is routinely available, widely available, and can be applied and tracked over the long term in terms of a sustainable access for different types of projects. So from a project development standpoint, when that data is not there, considerable amount of resources have to be devoted towards getting that data. And then engaging in any type of evaluation or tracking over the long term calls into question the sustainability of that project upfront, which means it will typically run into these one-off projects. And the second aspect that I see to that that's driving the lack of data collection is the fact that there are tools. There are tools that are available. There are tools that are out there. But how we're using these tools to build the connection of changes. Well, first of all, how we're using these tools to collect baseline data so then we can build out what those changes in urban nature or environmental health are and what they mean for health outcomes aren't yet set from point A to point B to point C. So at the moment, in terms of moving these projects forward, an extra amount of work has to be done to determine how we design that line from point A to point B to point C, which can then be even cost prohibitive in a lot of cases, and people will then tend to look to other projects that have done something similar, and it might not be applicable. So if we're to sort of get forward and get moving with this, the real big issue for me is data on the ground, but then also understanding what are the strategies for us to even collect that data on the ground, and what tools should we be using to not only notice changes in environmental outcomes, but changes in health outcomes as a result. So for me, yeah, data, and then being able to track it over the long term with the right tools.
Lots of really big challenges. I guess on that sort of note of data, information, and then helping build connections, I wanted to go to Sharon and ask, what types of tools do you think can be used to bridge that gap between the health sector and other local governments, government departments, for example, when it comes to actually accounting for these health benefits or nature-based solutions?
I've touched on tools just briefly when I compared cost effectiveness, cost utility, and cost benefit analysis. So the direct answer to your question, what kind of tools, really requires a discussion between the different stakeholders who would be involved in these planning projects. And that means having planners of different sorts at the table together with the public health agencies or actors at the same level. And that's the simple answer. A priori, we can't really say which tools have to be used, but it's good to keep in mind that there are certain tools used by planners, there are certain tools used by public health, and there's a degree of there's some path dependency in there because the tools you choose also determines the data that you need.
That's very interesting. Thanks so much for clarifying that. I guess on that note of exploring path dependency and recognizing that we can't always determine prior to the project actually begins, I was wondering, Brian, if we could ask a bit about your experience. So how easy was it to be able to use the EcoHealth Alliance framework, for example, to account for health benefits in your project in Peterborough? And as an extension of that, what incentives are there for any similar project accounting methods moving forward, and maybe what might you encourage that other communities follow in terms of your example and your experiences?
I think it was straightforward and was very applicable to our project due to the high density of people afflicted with addiction and mental health challenges in the area of our project. Through the consultation period, before we commenced the development of our urban park, there were people who would approach us and say, why would you do such a project in an area where we have these issues? And my response was, well, that's exactly why we would do a project such as this. So if other municipalities could see the socioeconomic and health benefits that this can bring to a community, I think they would be definitely inclined to move more aggressively to fund green space oriented projects. It's been a long journey to get to the point where we are. The urban park is a different sort of project. Yes, there is a significant green component to it, but there's also a high physical activity component to it. So I think we've done a good job in putting those together with the inclusion of the skating rink and the public square where other sorts of physical activity can take place, such as Tai Chi, yoga, that kind of thing. And it's in an area where we can really look forward to the gentrification and this being a catalyst for change, really, in the area. And it's something that, and I've said this before, intuitively, it's going to happen. And we know that the development of quality green public space is going to have these positive physical and mental health impacts.
I really like the note of change that you've left us with. It's very much positive, and it's very much, I think, points to sort of the last thing that I wanted to pose and touch on in this discussion, which is, where can we take action today? So to Michael, where can we take action today to move ahead with building healthier communities using nature-based solutions? Big question, but maybe you can tackle it.
Of course, no simple answer, but I think one of the ways we can do it, I hit upon in those priority areas at the end of the presentation I was giving, is that, you know, there needs to be a way to expand the scope of action at the local level. And I think one of the ways to do that is to expand the mandate that local and regional governments have around environmental health. And in doing that, it can be as simple as something as setting a priority at the provincial health level to allow municipalities to move forward with these areas, and then also look towards building that capacity. If you have a sense of priority that this has to be something that has to get done, the capacity will follow very shortly, especially if there's already a level of interest that's pretty high in that space to begin with. So I think, you know, building that capacity through an expanded mandate is one of the best ways forward we can move. And of course, in Canada, we do have examples of where this is already occurring. So we have an example in Quebec where at the provincial level, the law has been set for healthy environment as one of the fundamental aspects of land planning. And then in the case of British Columbia, we have a similar project where there is a direct connection between the provincial government and local communities for building healthier and more inclusive and more resilient communities based on a specific type of project granting program. So there's multiple ways we can do this. There's multiple ways we can expand mandates. There's multiple ways we can empower local governments to move towards greater action and not only support capacity development, but support capacity development that already seems to be occurring on the ground as of right now. The only other little aspect I would add to that is that it really comes down to connecting the space of environment, health, and climate together. So at the moment, we do see a lot of investment in each of these areas, but there we see that's exactly the problem, is that we see a lot of investment in each of these areas rather than one sort of focal point where this money could be used to work for better environmental health and work for more climate resilience with the same goals. In doing so, creating that sort of integrated system at each level of government that focuses on environmental health will create better funding streams to move these projects forward. And again, it will help stimulate capacity everywhere for greater collaboration. So, you know, difficult question to answer, and I thought I'd swing big with some of my answers, but you know, it is possible. We just need to start thinking of this as an interrelated issue where you cannot invest in nature without considering health.
A very great place to land. Thanks so much to everyone. This was a very illuminating panel. We do have some questions from the audience. I will toss the question out there, and whoever would like to answer, feel free to chip in. So the first question that we have here so far is, could true cost accounting or full cost accounting methods looking at environmental, health, and social costs be useful for integrating health considerations?
I think I can probably jump on that one first. I think any costing method that takes into consideration just not financial returns on any type of investment is fantastic for being able to consider the health benefits. As I sort of mentioned briefly in the overview of the report that I've been working on, one of the main tensions in valuing health benefits is that a financial value for good health isn't always applicable, and it's not always a good way to actually see what better health means. So if we're looking at sort of that more true costing, full costing way, we're looking at the sake of good health for the sake of good health, and that in of itself is a value. One of the main challenges, though, is connecting that back at the project level to show in terms of how my investment is going to produce a substantial return that then can speak to each other in terms of both the cost benefit or cost effectiveness of achieving a desired outcome. So as long as we're able to make that line between investment and returns a little bit more clear, I think using those types of methods is not a long stretch away from being able to be adapted into the health lens space for using nature-based solutions.
Can I pop in with a comment to follow up on Michael's? Just in terms of accounting for the benefits. If you use something like cost effectiveness or cost utility analysis, that will allow you a basis to compare the costs of preventative measures such as greenspace to other preventative measures and to treatment. And that kind of data is available. So if you were looking to compare the cost of a greenspace initiative to the cost of other preventative measures and the cost of treatment, what you would find is that typically non-medical interventions are less expensive in achieving similar objectives than medical interventions, and preventative interventions are almost always less expensive than treatment. So you have the argument for health for the sake of health, which is legitimate, but you also have the basis to say, well, we can achieve these objectives more cost effectively using an NBS approach, a nature-based services approach, than approaches X, Y, and Z.
And I don't know if you have anything else to add to that.
Don't really. I'm not an expert in that area. I'm a simple landscape architect.
That's totally fine. If not, then I can actually move on to the next audience question, which was, what might be the first step a municipality would take to start planning for integrating health with urban planning? Is there an initial project a municipality should undertake to begin?
I can jump in on that. I don't think there's a what should be done. I don't think there's an answer to what should be done first. However, there are some very nice examples that could be used. I can send some of these, but the province of Quebec has a number of very good examples in which health impact assessment has been used in the course of urban planning. The province of Quebec probably has the sort of the deepest level of integration at the urban planning level of health impacts. And this stems directly from 20 years of legislation that's 20 years, public health legislation that's 20 years old that requires the use of health impact assessment and other health assessments in a variety of initiatives, urban planning and other areas. The National Collaborating Center for Healthy Public Policy has a number of studies that are available. I can send links to these after the webinar. And there are a number of other pockets of strength across Canada where health assessments, in particular health impact assessment, have been used very, very effectively and can offer some guidance. That's it.
I can pick up on that as well a little bit. What I would say in terms of initial steps, so a little bit less procedural from my perspective, but I mean, the first thing, if you're looking at integrating health considerations in urban planning, is to find out what health considerations are actually applicable in your area and where pockets of poor health reside and how that interacts with the urban environment. And I think one of the best ways to do that is look at areas of green space deprivation. So one of the main things we're finding is that a lot of negative environmental health impacts first occur in those spaces, and they've been occurring in those spaces for a long time. So there may not be direct connections to connect that data together, but it's a short hop in the right direction to be able to get to that point where you would be able to start scoping out what environmental impacts you're looking to alter, and then what health changes you're also looking to achieve by investing in these spaces or by changing the way that you engage in urban planning. So it's really, really identifying what the health impact is you are trying to affect from the outset and integrating it as a primary project objective rather than it being added on as something you would consider down the line. So having that first, looking at where health impacts are possibly being negative in specific deprived urban green space areas, and then moving from there forward would be my suggestion.
Could I pop in with
Although there
one
were,
suggestion?
oh, please go ahead.
Oh, sorry. Go ahead, Brian.
All I was going to say is that for us, we understood that although there wasn't any effort to quantify it, we knew that that there was this problem in the downtown, like I mentioned earlier, with the marginalized, especially the great proportion of it within this area of the downtown. The previous condition of the area could be described as oppressive, except for the abutting apartment building property. Nary a tree existed on the site. And it has been shown that a poor environment makes people feel downtrodden. So that was, anyway, I just wanted to express that perspective. Thank you.
I also wanted to just add in the perspective of looking beyond green space, urban renewal type planning initiatives to other areas in which natural-based assets could be useful. So if, as a municipality, you have initiatives such as flood control, then that's a really good space for considering nature-based services and their health benefits. So just as an example, instead of what would typically be a civil engineering project to in an urban riverway, there are a number of projects that are now in place that are using vegetation and the natural banks of rivers rather than an engineered project. And these types of projects augment green space and have a number of documented health benefits. They also have some potential decrements as well, which would need to be considered. But in answer to the participants' question, look beyond sort of the green space for green space, urban renewal type projects to places where natural-based services could replace typical engineering initiatives.
I think that's a great point.
Go ahead.
I was just going to say, I think that's a great point, and there's a great example of it here again in Peterborough, where we had to construct a flood diversion sewer to protect our downtown from flooding, and we could have just, built a flood diversion sewer and rebuilt the road, but in fact, it's being completely transitioned to a trail and more of a natural approach to a streetscape through an edge of the downtown core that has really needs some renewal and to really improve the area. So thanks, Shira.
Well, thank you for that great example.
Mm-hmm. Mm-hmm.
This has been a really, really great Q&A session. Unfortunately, in the interest of time, I do have to sort of call the session to close, although it's been a very quick hour. I'll note that if there are sort of unresolved questions, we will be dropping a feedback form. Please feel free to submit any outstanding questions that you have through that form, and the panelists will definitely get back to you with any answers or insights they may have to share. So just a quick round of thank yous to Michael, Shira, and Brian for your time and all of your incredible insights. Thank you so much to everyone who attended today for your engagement and for sticking around to learn about nature and health. I certainly learned a lot. Please, again, just as a reminder, do check out the report, which I think will be linked in the chat, and please join us on November 18th and the 25th for our other webinars on health. We do have a 3-part series. And as I just mentioned, we are sharing a link in the chat for a feedback form. So please feel free to send us any feedback that you have or any questions that you would like answered. And that's about it, I think, for us. Thank you again for joining us today, and we look forward to engaging with you at our future events.